Hey everyone, welcome to Wealth Redefined. I'm your host, Michael Reynolds, certified financial planner and owner of Elevation Financial. You can find me on the web at elevationfinancial.com. So today we are going to talk about Medicare, Medicare Enrollment 101, kind of a guide to help you understand how to sign up for Medicare, all the different parts and pieces, kind of how it works, and just kind of a general overview of Medicare. So if you're turning 65, congrats, you've reached an important milestone. You can finally enroll in Medicare. Or maybe you're not yet 65, but you're still curious about what Medicare is and how it works, so you can be prepared for the future. You might even be more excited than most if you've been postponing retirement until 65 to avoid paying for expensive health insurance. But even those who've already retired are likely looking forward to, Medicare enrollment. It's a pretty low cost overall health insurance program for those over 65. So before you can check Medicare enrollment off your checklist for the things turning 65, it's important to know how the process works. So unfortunately, Medicare enrollment is not straightforward. It's kind of convoluted. Making mistakes during the enrollment period initially can result in costly penalties, gaps in coverage, insufficient coverage. And so we want to make sure we get it right. So we'll review the basic parts of Medicare, the enrollment deadlines, how to enroll, and some common costs you can expect. So first of all, what am I enrolling in? What is Medicare? Before diving into the timeframes, you want to understand what you're actually enrolling in. Many pre-retirees mistakenly think that all Medicare is the same, but in reality, you have many decisions to make about the parts of Medicare you'll enroll in. The main components of Medicare include the following. Part A, which is hospital insurance. This covers things like hospital inpatient care, hospice care, home health care, and some types of skilled inpatient nursing home care, which excludes long-term care. Part B covers preventative and medically necessary services that diagnose or treat medical conditions. So examples of these services include doctor's visits, some outpatient services, some mental health services, and prescribed durable medical equipment. Part C, which is called Medicare Advantage, offers an alternative way of getting the same coverage found under Parts A and B. A and B is called Original Medicare. Medicare Advantage gives you additional coverage, including coverage for the 20% that Parts A and B don't cover. Medicare Advantage plans, which are often bundled with Part D, which we'll get to in a minute, are provided by Medicare-approved private insurance companies. So individuals typically have dozens of Medicare Advantage plans to choose from depending on the state they live in. Then there's Medicare Supplement or Medigap. Medigap supplements Part A and B, which is different from an Advantage plan, which is kind of an alternative to Medigap. But Medigap pays for some of the costs for covered healthcare services and supplies, including things like co-payments, co-insurance, and deductibles. Some Medigap policies also offer additional coverage on services not covered by Parts A and B. Then there's Part D, which is prescription drug coverage. Part D assists with covering the costs of prescription medications. The coverage is optional, but penalties will apply if you delay coverage. But it's available to anyone with Original Medicare, which is Parts A and B. Most Medicare Advantage plans bundle in prescription drug coverage. So as you can see, it can be a bit confusing, a little bit convoluted, but stay with me. So when can I enroll? When can you enroll in Medicare? There are a lot of key dates to consider, but Parts A and B enrollment can be signed up for during their initial enrollment period, which lasts for 7 months. The initial enrollment period begins 3 months before you turn 65 and ends 3 months after. So if you have an August birthday, then your initial enrollment period, or IEP, is from May to November. So when coverage begins depends on which month individuals enroll, but the earliest it can be is your birthday month, and will always start on the first of the month. So because of it can sometimes take months to actually get activated and up and running. So it's a good idea to enroll early if possible. Signing up for Medicare during the initial enrollment period is not optional for most people. If you miss the initial enrollment period, you might have to wait to sign up until the next general enrollment period, which might result in a delay in coverage and a lifetime late enrollment penalty. That's a lifetime penalty. So you don't want to get this wrong. The longer you wait to sign up, the higher the penalty. So once individuals have enrolled, they can make changes to their Medicare coverage during the open enrollment period, which is October 15th through December 7th each year, or the general enrollment period, which happens annually between January 1st and March 31st, depending on their circumstances. In limited special circumstances, some individuals can make changes to their coverage or enroll in Medicare for the first time outside of the initial and general enrollment periods, but only if they're eligible for what's known as a special enrollment period. These special circumstances might include things like changing address outside your planned service area, losing certain existing coverages, or being offered coverage change by your employer. So Medigap, Medicare Advantage, which is Part C, and Part D enrollment have different timelines. So individuals will need to have enrolled in Part A and B before signing up for Medigap, Medicare Advantage, or a Part D program. So in most cases, you have only 60 days to enroll in these plans after you've enrolled in Part A and B. Once you've selected either Medigap or Medicare Advantage, you have your entire first year as a trial period to possibly switch to the other if you're not satisfied. After this time, you can only switch during limited times of the year, and you might be subject to medical underwriting. So how do you start the enrollment process? So we've kind of covered the parts of Medicare, what the enrollment windows are, and the process for signing up for original Medicare, Parts A and B, is relatively simple. If you're already receiving Social Security benefits, you might already be enrolled. So these are some of the options for enrolling if you're not currently receiving Social Security benefits. First, apply online. This is the preferred way, I would say, the easiest and usually the fastest. To sign up for Medicare online, and that's on the Social Security website. And you'll need to create a secure Social Security account if you haven't got one already. And if you're already collecting Social Security, you're automatically enrolled in Part A and B. You can also just call the Social Security office, and you can enroll by phone. If you or your spouse worked for a railroad, you've got the option of reaching out to the Railroad Retirement Board, and they can handle it for you in those cases. Generally, applying online is ideal, so that's the route I would recommend. So enrolling in a Medigap, Medicare Advantage plan, or standalone Part D plan requires more effort. Because you likely have many plans available as options, this is a good opportunity to review your medical needs, research various plan options, and review potential costs. So again, once that process is complete, once you've done a review, you can enroll in a plan online at medicare.gov, or you can call as well, but you enroll online is typically the fastest and easiest. So what costs should you anticipate? So when it comes to Part A coverage, most people don't pay a premium. And that's why it's often known as the premium-free Part A. Most people are eligible for premium-free Part A at age 65. Those who have paid Medicare taxes for a certain amount of time while working, or anyone who's already receiving or will receive Social Security benefits or Railroad Retirement Board benefits qualify for premium-free Part A. If you do have to pay for Part A coverage, you might be looking at a premium between $285 and $518 each month. That's as of this year, 2025. The number will depend on how long you or your spouse worked and paid into Medicare taxes. Additionally, you'll be subject to a deductible of $1,676, as well as a potential range of co-insurance payments. Again, that's as of right now, as of this particular date we're airing. For Part B coverage, the standard premium for most individuals is $185. Again, that's in 2025. However, you might pay a higher premium depending on your income. Additionally, you might also pay 20% of the Medicare approved amount for most outpatient therapy, medical equipment, and doctor services, including ones rendered as a hospital inpatient, unless you have Medigap or Medicare Advantage, which will provide a cap on total medical costs. So monthly premiums vary by plan for Medigap, Medicare Advantage, and Part D, and you can compare those costs again online at medicare.gov. By the way, there's links to all these in the blog post version of this episode. So if you want to go get those links, grab the article version of this, and you can see all those links in the article. All right, so that's the general overview. So it's a big transition for many people, and Medicare comes with a lot of key differences from employer sponsored or marketplace insurance. So if you're turning 65 soon, get some help. Talk to me, talk to your financial advisor, talk to a professional you trust about completing maybe analysis to kind of see what type of Medicare plan makes sense for you and which parts to enroll in, and to help you with that process to make sure it goes smoothly. You want to find a plan that meets your needs, your preferences, and your budget. And so it's not as easy as just clicking a button. It's a few things to consider and review and figure out what's best for you. So take a look before you turn 65 and kind of get prepared for it and dig into what the options are. All right. With that, you're welcome to reach out to me anytime if you have questions. My website is elevationfinancial.com, and I'm pretty much on every social platform. You can find me there, and you can schedule a consultation on my website if you're interested in learning more about becoming a client. Always available. That is free. Again, elevationfinancial.com. All right. Thanks for joining me today. Have a great day. We will see you next time.